Hi, everyone. I'm Alana. I'm a massage therapist in Cochrane, Alberta, and this presentation is on headache and migraine. You're watching a pre-recorded Zoom workshop. There'll be absolutely ways for you to contact me with questions. If you see something in the presentation that you want to talk about more, I'm very happy to chat about headache and headache management. It is something that I do a lot of in my practice. I'm sitting here on a day in early March where we have had a 20-degree temperature swing over the last couple of days. And I know a lot of people are suffering from headaches. It is really common, especially where we live, but it's common everywhere. We just happen to have this extra weather trigger that not every environment has. Headache is pretty complex. There's a lot of factors that interact to form headaches. They can be a condition themselves, a primary condition, or they can be secondary to something else. They might be caused by another condition or even side effects to medication you're taking. And that can make them difficult to understand and difficult to treat. I think there's a lot of factors that contribute to causing headaches, and that's part of their complexity, but symptom management is very possible. In my practice, I see a lot of people with headache, and almost everybody we get some change for, whether it's severity or frequency, or hopefully both. Occasionally, we don't find ways that we can help, and I always am very honest about that with clients that, you know, we've reached the end of what I can do, and so I'm happy to refer out at that point. But for the vast majority of my clients, we see change. The real key to seeing change, though, is home care, the things you do for yourself at home. So this presentation is designed to cover a little bit of information on triggers, but we're not going to spend a lot of time there because for so many people, we have multiple triggers that interact to form headaches. And I'm much more concerned with outcomes. So the presentation is designed to give you some self-care tools that you can use right away. I want to be clear that, of course, I think manual therapy is really helpful for headaches, whether that's massage or acupuncture or chiro or physio or osteo or whatever it is that you like. I absolutely think it's helpful, but I don't think it's necessary. I think you can get a lot of change with some good self-care tools on your own. So that's where we're going with this. Again, I'm absolutely happy to chat about any of the information in here. There'll be some contact information for me at the end, and please feel free to use it. Okay, so we'll be talking about headache triggers, the muscular factors that contribute, the nervous system factors that contribute, and also a lot of self-care skills that'll be happening throughout the presentation. Okay, let's get into these triggers. So, like I said, often for people, there's overlapping triggers going on here, and so that can be a challenge. One of the big ones we see in our area is weather or pressure changes. So when we've got a pressure change in the atmosphere and the pressure in the air outside your body is different than the pressure inside your body in your sinuses, this can cause quite a few different factors that can contribute to headache. So vasoconstriction is just the narrowing of the arteries that feed the brain with blood. We can also get excitation or activation of the trigeminal nucleus. So we'll talk quite a lot about the trigeminal nerve. It is the nerve that feeds the muscles of the jaw. And of course, jaw dysfunction contributes greatly to headache. But the trigeminal nucleus does all the sensory information for the jaw, the face, and the scalp. And it has its own pain pathway directly into the brain. The rest of the body uses a spinal cord to send pain to the brain, but the face, scalp, and jaw gets their own special pathway. This pressure change can also cause hypoxia, which is just a lack of oxygen in your brain, or barotrauma, which sounds much worse than it is. It is tissue damage that's caused by that pressure difference. Okay. Hormones, a lot of people out there get hormone-based headaches. If you notice that your headaches are tied to your cycle, it's probably because you get that estrogen dip right before you start menstruating. And estrogen controls neurotransmitters like serotonin, dopamine, and glutamate. Lots of other things interact with those neurotransmitters as well, but estrogen is a big factor. All of these neurotransmitters are involved in pain modulation and signaling in the brain. They're also all involved in mood and cognition. Caffeine, those of us who are regular caffeine users know that if we don't get caffeine in our body, we're probably going to feel pretty gross, headachy for sure. So caffeine is a vasoconstrictor, so it narrows arteries, which, as we talked about in the weather trigger, that can cause headaches. But when our headaches are caused by dilated or big open blood vessels in our brain. Caffeine is very effective to narrow those, so we're not getting that pressure sensation or too much blood flow in the brain. And stress. Stress is a massive trigger for not just headache, but a lot of other disease processes and inflammation. It also interacts with all these other triggers. So you might notice that your weather headaches are worse when you're highly stressed. Your hormone headaches might be worse when you're highly stressed. And stress has effects on muscle tension. For a lot of us, we carry our tension in our shoulders, right? We sit often with our shoulders up around our ears, activating a lot of the muscles through the shoulder and the neck. We get trigger points in our muscles. Trigger points are poorly understood physiologically. We don't really know what's happening inside the muscle with those trigger points. But they are those knots that you get in your muscle. So they're kind of hard, dense points. And when you poke on them, they're sore. What we do know about trigger points is they tend to send their pain to specific areas of the body. That pain pathway is very predictable. We also know that they respond disproportionately to stress. So when a muscle is stressed, it will increase the tension that it is experiencing, whether that stress is physical stress or emotional, psychological stress. The trigger points actually respond more than the rest of the muscle does. So they are primed to cause pain. And when we're stressed, they are easily excited and they cause more pain. We also end up with nervous system dysregulation from stress. Not all the time, but those of us that live with chronic stress certainly are prone to nervous system dysregulation. And all I mean by that is our nervous system should be able to switch back and forth quite easily from our stress response to our relaxation response. And when we get dysregulated, we get worse at switching back to our relaxation response. For a lot of us, that becomes chronic, and we end up with the symptoms of nervous system dysregulation. And a few of those symptoms involve chronic headache and migraine and chronic neck and shoulder tension. I'll talk just a little bit about why that happens. But if this is something that is interesting to you, I do a lot of work with nervous system regulation in my practice, physical ways to re-regulate our nervous system. And there is a video on the YouTube channel as well on vagus nerve health, which will talk a lot about nervous system dysregulation. Okay, so we've got these muscular triggers. We have common trigger points with headache and migraine referral pain pathways. So I'm just going to grab a slideshow on these trigger points so that I can show you where these ones are. I'm not going to specifically talk about all of these trigger points because some of them, including this first one that you can see up here, have some pretty delicate structures associated with them. And I don't want people potentially injuring other structures in the body while they're trying to get at trigger points in the muscle. So especially anything that is on the front of the neck, I'm not going to teach specific trigger point work for those, but I will show you how to stretch out those muscles and how to get some interaction from the muscle to your nervous system so that we're drawing the brain's attention to where that pain pathway is. So as you're looking through these, you can see there's these blue X's throughout the muscle, and then the blue shading is where those points send their pain. So typically when I show someone a trigger point map, they can pretty easily identify where their headache pain is. As you'll see, there are a variety that look similar to each other. So you might have more than one muscle contributing, or you might notice that there's really similar pain pathways in here. So for these guys, we've got SCM, temporalis, and trapezius. All of these sort of sending their pain in around the ear and forward of the ear. Especially SCM and trapezius are really classic headache causing muscles. And so just a little bit of note on working with our muscles and with our nervous system. My bias is towards letting the nervous system feel safe while we're working. And so when we cause ourselves pain, we're already in pain, and we get in there and cause more pain, that can actually be an effective way to reduce the pain that we're experiencing. However, causing yourself pain in an area that's already agitated and feeling inflamed and vulnerable can also send a message to your nervous system that this area is an injury. And when we have injury, we respond to that with guarding and inflammation. So guarding is more muscle tension in order to stop things from moving around that feels bad to our nervous system. And we don't want any extra tension in these muscles, especially when they are not protecting an injury. They're just a chronic pattern. And inflammation actually is great for healing. It's part of our natural healing process, but we don't want to cause extra inflammation, again, especially when we're not injured. So what I like to do with trigger point work is find a way to increase the communication from that muscle to the nervous system. Basically, when we want to draw our attention to that area, and in a sense, ask the brain to reevaluate what's going on there. Do we really need to be holding that much tension in our upper shoulders or in our neck? When we get the brain to pay attention to it, we might just get a natural relaxation of those muscles. So what I like to do, and I'll show you this one with the trapezius trigger points, because they can be, you can work on those. You can definitely put a lot of pressure in there if you need to. So if I'm working on trapezius trigger points, almost everybody has these in the top of the shoulder. I can use my hand to work through the tissue and find those spots that feel extra sensitive. When I find a spot that does feel kind of hard and dense on the top of my shoulder, if I can get enough pressure into there, I might notice that it starts to send pain elsewhere. So again, typically with this one, it's going up the side of the neck and around the ear like a question mark, maybe even coming into the jaw. It can be hard to get enough pressure here to get that sensation. If you've got somebody else who can help you by putting pressure on there for you, that's great. You can coach them for how much pressure you need. And what I like to do, both for working on myself and for working on my clients, is get just enough extra sensation that I start to notice an increase in pain or referral pain, but not so much that I'm spiking my pain response and clenching my jaw and holding tension in other parts of my body. So I'm tensing up against it. So it's kind of a fine balance between getting a little bit more sensation without actually causing ourselves a lot of pain here. So if I find a trigger point that I can increase the sensation on and get some extra sensation, I'll hold on to that while I take a couple of big deep breaths, really trying to relax the shoulder that I'm working on, relax the rest of my body, and wait for that sensation to change. You might notice that it increases initially, gets more intense. And if it's tolerable, you can hang on to that and wait for it to drop down again to get less intense. And I will say, just as a caution here, most of the time when we work on trigger points or on muscular work for headaches, we do get a reduction in pain. Occasionally, we actually increase pain. We're poking at stuff that's already inflamed, already irritated, feeling a little bit vulnerable. So it is a risk that we can actually provoke headache. So I want that disclaimer out there. The vast majority of the time, we're getting really good success and we're reducing pain, but there is a possibility that we increase it. What tends to happen with increased pain post-treatment is for the couple of hours after the massage or maybe later that day, the headache seems to intensify a little bit. It's not usually awful. And then it resolves after that as your nervous system starts to accept that change. It's rare that we get a bad headache provoked after treatment. So if you are finding when you're working on yourself that you end up increasing your headache pain, I would suggest going significantly more gentle, even though for most of us that's counterintuitive. And the other thing that I always use to help integrate this change is applying heat and doing some movement. So heat is great for actually changing your pain response. It's great for softening up muscles. And movement is what helps your brain to integrate what feels like change to the system. So heat and movement are your friends for managing any kind of muscular pain you get post-massage for yourself, whether somebody else did it for you, and whether it's headache or anything else. That's always my go-to. So if I get that response, so I find my trigger point, I press down on it, maybe I'll use my other hand to increase pressure a little bit, pulling down on my arm that's providing the pressure, and I'm just kind of curling my fingers into that spot there. Let me just increase this size so you can see a little bit better what I'm doing. So I'm just kind of curling my fingers, driving them into the muscle tissue and then pulling down. I wait to get change. And after I get change, I reward the nervous system and I soothe. So I do a little bit of gentle massage to, again, allow a healthy message from the muscle to the brain so that we're not telling our brain that this is an injury. We're attracting attention, we're getting change, and then we're soothing. So gentle massage is great for soothing, as is movement and stretching. So you can stretch away, rotate the head both directions, even just a little bit here, moving back and forth so that your brain can integrate that muscle feels better now. It feels softer. It feels less intense. After you've soothed, give it a rest. Let it sit for a minute or two. You can throw some heat on there if you want to, and then you can go back and poke it again. What we tend to do is like poke with no soothing and no rest in between. And then I think we end up just causing this messaging from the body to the brain that says it's an injury, guard it, protect it. If you're finding that it's difficult to get enough pressure on that trigger point by yourself and you don't have somebody who can dig in there for you, even stretching can be really helpful to attract the nervous system's attention there and get those points to relax. So what I like to do with that is to sort of bring my hand over my whole muscle, and I'm just pressing my whole hand down into that muscle tissue, and I can pull forward with it or pull out to the side and then move my head away. And again, you want to wait for things to feel different. So you can wait here, give it 30 seconds, give it a minute, give it some nice deep breaths so that eventually it actually feels different. Because that's, I think, also what a lot of us do is we don't wait long enough to get change. So we're doing some work, but we're not actually waiting long enough for the nervous system to respond to it. Okay, here's another couple of common ones I see. Semispinalis cervicis, splenius capitis, and splenius cervicis as well. So this one is probably the more common one that I see out of these three. Trigger point at the back of the neck that refers up the base of the skull. And so to get into these ones, if I'm doing trigger point work with these ones, again, I'm going to hook my fingers and reach back so that I'm curling my fingers into the tissue at the back of my neck. And once I find that spot that's a bit tender and sensitive, I like to add a little bit of movement in here as well. Adding movement is just another layer of input into our nervous system. So rotating back and forth is great. Nodding up and down, stretching the neck forward. This can feel really good back here. And if you find a position that feels good, that feels effective, that feels like you're getting a lot of change, then just hang out there. I turn this way and I notice that feels really nice. And sometimes nice is like the quote unquote good pain, right? We're not spiking that pain response, but we're getting some good quality sensation here. Feel free to just hang out there, whichever direction it is that feels good. While we're going through these muscles here, if you notice what your headache pattern is, feel free to write down the name of that muscle. If you are talking to me about it later, you can even just give me the number of the muscle and I can reference this to see what it is we're talking about. But otherwise, feel free to write those down, because then when you're seeing your manual therapist, you can say, hey, I think that my pain pathway looks like the one that comes from semispinalis cervicis. Can you check that out? Okay, a couple more common ones here. So these muscles of the jaw, for the most part, I'm going to show you just one treatment here, because these do have some pretty delicate structures along with them. So both medial pterygoid and digastric have trigger points that are pretty close to some sensitive structures underneath the jaw, like lymph nodes and parotid gland and stuff in here. So I'm not going to show how to get into those specifically. I'll show you an indirect way to do that. But if you have headache that is caused by jaw muscles, this looks familiar to you, I highly recommend seeking somebody out for some jaw work. If you haven't had jaw work done before, it tends to be pretty intense. The best work is done inside the mouth. Your therapist will wear a glove, and we'll get to the muscles, typally up in here, beside kind of underneath the cheekbone here. It tends to be quite intense. There are people who do it gently. I'm one of them, and I learned from another great therapist in town, Clarissa at Curative Massage Therapies. Highly recommend her work for jaw, because it doesn't have to be really painful, but that's typically what most of us are taught, is just to get in there and do the work. It does feel better after, but it's pretty intense. So if that's not your jam, if you like something that's a little more gentle, seek out somebody that does their work gently. So if you're seeing these pain pathways and feeling like they're familiar to you, lateral pterygoid tends to be kind of like cheekbone or ear pain. Medial pterygoid, also ear pain, and inside the jaw pain. It might feel like there's pain sort of near the bone at the back of your upper teeth. And then digastric as well tends to come back up behind the ear like this, giving you a headache kind of back here. Quick note on tooth pain. Really, it's not good to ignore tooth pain. If you're confident that the pain that you're experiencing is muscular because someone's checked that out for you, then great, go ahead and do some stretching, get to a therapist to get that stuff softened up for you. However, if you don't know that your tooth pain is coming from a muscular trigger, I highly recommend seeing your dentist for it. Tooth and jaw health is actually super essential for the health of your whole body. And if you have tooth pain that is very intense and sets on very quickly, especially if you have a history of heart disease in your family, or you're getting anything that feels like shortness of breath, or pale and clammy skin, I would absolutely get to the hospital for that, call 911 for that. Tooth pain can be a sign of heart attack, and it's more common in women than it is in men. It's not one of the super common heart attack symptoms, but it is something we don't want to ignore, that tooth pain. So if you're in doubt, please get that checked by a professional. Okay, so if you've got pain in lateral pterygoid, this one you can work on. There's not a lot of sensitive structures right in here. The easiest way to get into this one that is outside the mouth is to open your jaw about halfway, and then you're going to have your fingers below your cheekbone so you can feel where the jaw opens and closes there at the joint. You're going to come just forward of that joint, which you can feel kind of moving against your finger, and just underneath the cheekbone. And when you open your jaw about halfway and work into that spot, you'll feel it if it is one of the ones that's causing you pain. So that one you can definitely get to work on, treat it the same way as all the other trigger points, poke it, get some change, reward it, soothe it, do a little bit of movement through your jaw. For medial pterygoid and digastric, as a less direct way to get after them, I really like to take the skin and move the skin around, because when we do that, we do activate all those little superficial nerve endings that sense changes in movement, in stretch, and that sort of that mechanical change around the tissue. So you can pick up, like pinch the skin, and then try and roll it between your fingers in whatever direction feels good. I like to go over the whole kind of angle of my jaw. This is something that I do just kind of absentmindedly when I'm sitting around watching TV or reading a book or something like that, because it does really help. It's hard to see what I'm doing there. It does really help to change the way the muscle tissue feels. So I'm basically just picking up skin and trying to push that roll of skin in any direction that feels good. You can also just pinch and hold, especially if you're feeling sensation in through those muscles, if you're getting that increase in pain to the headache. But give it long enough to change. The other thing you can do on the same sort of theme there is even just to get two fingers near the site where you're feeling that pain and push one up and pull the other one down and hold that tension there over the skin as you wait to get change happening. And this is a technique you can use anywhere in your body. Again, it takes a while, so give it a chance to actually feel different when you're working. Okay, a couple of other really common ones here coming up. These are some of the ones I see most often, these headaches that refer into the eye or behind the eye and the sinuses. The suboccipitals, this is one of the most common trigger points that I see. And you can't get to the bottom of the image here, but the trigger point is right at the base of the skull, right in here. Very close to this trigger point as well, semispinalis capitis. I see this one a lot. Hard to tell the difference between these two because their location is similar and the referral is similar. But it doesn't really matter that much if you're not sure which muscle it is that you're dealing with, as long as you're getting a response from the tissue and you're getting change to your symptoms. This one, number 11, the suboccipitals, it shows its referral more kind of back on the side of the head. Where most people seem to get this referral is, in my experience, a little bit farther forward behind the eyes and into the sinuses. This one also feels like it goes up the back of the skull for a lot of people. And so it's kind of this like inside my head sort of headache, but often people describe it as behind the eyes and in the sinuses. So these are ones that I work on a lot. So for this first one, occipitalis, that muscle is a big flat muscle at the base of your skull. Nothing sensitive in there. So it's fine to get in here and work to, whatever degree feels good. You'd be on the flat bone of the skull here and pressing in against the bone and just working your fingers around until you find that spot that does feel pretty intense. The other thing I like to do for occipitalis, actually all three of these, is to do a hair pull. And when we do a hair pull, obviously we're not trying to hurt ourselves here. So you want to grab a nice fistful of hair and pull sort of opposite to the direction where those muscles are and hold that. You'll get a nice stretch through the scalp, through the skin on top of where the muscle is. And I just hold this. I'll often find that when I'm doing that movement, it'll dull the headache pain quite a lot while I'm doing it. Again, you need to hang on to it for a while to get any of that lasting change. But it's something you can continue to do repeatedly to get that headache change. Okay, so the other thing I really like for suboccipitals and for semispinalis capitis is to use my thumb at the base of my skull, actually on the neck, into those muscles, and then getting a little bit of movement in order to help this as well. So normally I would use this hand to do this work, but that makes it maybe a little bit difficult to see. So I'm going to use my opposite hand. I wouldn't be able to get enough pressure here with my opposite hand, but just so you can see what's going on, I would get my thumb in here, rotate my head away, and then do these little nods up and down. So again, if I'm using my hand on the same side of my head here, I'll bring totally back so you can see it, pressing in hard, head nodding, rotate away, head nods. And it might take 15 or 20 little nods to feel that muscle start to soften up. But that one I find really effective. The other thing I'll do to get into these guys is use a ball like a lacrosse ball or a massage ball. And typically I would do this laying down on the floor. So I'll just lay down on a yoga mat or something, and get the ball in my hand right at the base of my skull. And I'll kind of roll my head back and forth until I find the spot that feels the most intense. And I just let my head sink into the ball, let the ball sink into the tissue. And again, wait to feel that change and then do some soothing. So you can do a little bit of gentle massage with the ball, with your hand, or a little bit of movement. For these suboccipitals, the way we want to do movement is movement of the skull on the spine. So if, that's your spine and that's your skull, we want to do this sort of movement where the spine stays straight and the head moves back and forth, as opposed to a full bend of the neck. If the skull stays in the same position, you're not going to get a lot of movement in through those suboccipitals. So the way we do that with, our body, not a finger and a ball, is to, first of all, bring our head back. So we're trying to bring our neck, our upper spine backwards. So our head is sitting more on top of our torso, ear sits over the shoulder. And then we can do a chin tuck. So we're going to bring the head back as far as we comfortably can, and then tuck our chin in towards our throat. You are aiming for the maximum number of chins possible here, and holding this position. So we're feeling a stretch at the base of the skull, as opposed to necessarily all the way down the neck. When I'm really tight and I do that movement, I will feel that one at the base of my skull, but I also feel it pretty much all the way down my spine, down into my, against my rib cage. So those ones I really like. One more technique for these guys here, and this one I also use for SCM, which is that first one that I showed you, is finding the spot that feels a little bit sensitive, getting my fingers in there so I'm getting good contact with the muscle tissue, and then I pull down on that skin as if I'm trying to drag the muscle away from the bone, pulling down on that tissue, and then tipping my head away just a little bit. So I get a really good feeling, but quite intense stretch in here. And I wait for change. I feel like I'm saying the same thing over and over again, but you want to wait for change. And then again, soothe. But that one I'll do a lot, just kind of anchoring into the tissue, pulling it down, and then letting my head move away to get a little bit more stretch there. Okay, so these last ones are muscles that refer into the face. So again, for a lot of these, a little bit sensitive structures, so I'm not going to dig in here on these and try and get change. But you can use that twisting the skin technique. You can use the pinching and rolling technique. You can use stretching for sure. Frontalis, this number 15 here, this sort of classic eyebrow headache, that one you can get in and dig around pretty good. Find the spot that feels sensitive, wait for change. This also is one that you can get at by hair pulling, upwards to get that muscle tissue stretching up across the tissue there. With orbicularis oculi, for sure, I would not dig in around the eye here. You've got a nerve pathway there. That's the trigeminal nerve pathway, which we're going to be talking about in a sec. And whereas it might feel good for the moment to dig into those areas and even onto that nerve pathway, If you're right on the nerve and pressing it up against the bone, you'll probably get some pain relief from that because you'll be basically preventing the nerve from communicating to the brain. But you'll also be increasing the inflammation in that nerve. And we actually really want to decrease the inflammation in the nerve. So for something like this, number 16, I would do really gentle circles around the eye, just over and over again, trying to soothe that tissue. You can also definitely take tissue and pull and hold in any direction that feels good. Same with platysma, that last one there. I would not be poking hard on the front of your neck, way too many sensitive structures there. But a good stretch for this one is doing this exact position that this person is in. I like to press my hand down onto the skin just below my collarbone where that muscle is attaching, and then very slowly and very carefully stretch away. There's a lot of muscles that you'll get stretched in this one here. And if you go too fast, it can feel almost like burny, not a good feeling. So nice and slow. You could also try getting into the position first and then taking your hand and gently pulling down on that tissue. Like I just doing this position, I get a decent stretch, putting my hand here and just starting this pull, I immediately get a intense, it's nice feeling right now, but if I go any farther, I know it's going to feel pretty bad because I've done it to myself. So gentle work on those guys. And as I've said lots and lots of times now, making sure we're staying in that gentle range so that we're getting good quality change that feels really good to our nervous system. Okay. I want to get back into this presentation and I don't want it to start over again from the beginning. I wonder if I can do that. No. So, quick review. We'll just click through these here to get back where we were. This is just a nice refresher of those triggers we talked about earlier. Okay, so when we're intervening, trying to do some work for our headaches, we've got that self-massage for the trigger points that I just demonstrated. I'm going to talk a little bit about nervous system work. All of these interventions, right, we're trying to increase the body-mind connection between the brain in these specific areas so that we can get some good change happening there. I'll talk about strength and stability and stretching and movement at the end of the presentation. Okay, so nervous system. The nervous system is in control of everything. It really is what drives how tight our muscles stay, whether we accept the change or not, what that change is going to feel like. And for headache management, often the nervous system itself is what's involved. So I've had people come to see me who will say, any amount of body work typically feels bad, whether it's massage or anything else. It often provokes my headaches. I feel worse afterwards. And if that's the case, I always go to nervous system work for this person. Obviously, if they're willing and open to try it, it is very, very gentle work. There's no digging in and, poking stuff and trying to get a pain response. We really are working on soothing the nervous system. And because headache is a symptom of a nervous system dysregulation, it's possible that it's actually the nervous system dysregulation that's driving that headache pain. So really quickly, I don't have time to get into all the interesting stuff on the vagus nerve here. But again, if you're interested, there's already lots of information, both on my website and the presentation that's on the YouTube channel there. But very quickly, your vagus nerve is a massive cranial nerve, leaves your brainstem and travels through your throat, your chest, and your abdomen. And it deals with all of the essential structures that are involved in living in homeostasis and keeping your body healthy. It's got three main roles. It gathers information from your body and brings it into your brain for processing. It is your full connection between your gut and your brain. So when we talk about gut-brain axis, that is the vagus nerve. And it is what turns on your parasympathetic or your relaxed nervous system. So when we live with chronic stress, we can end up, there's a lot of ways that we can end up with vagus nerve dysfunction, but one of those, and the one that we're mostly talking about here, is living with chronic stress. The brain can start to ignore the information coming in from the vagus nerve because it feels like it's under threat from the external environment or whatever other threats are happening. So the vagus nerve is still going to continue to function to some degree. It does things like regulate your blood pressure and your breathing rate and your heart rate and your digestion and some emotional regulation. It deals with a lot of structures like the esophagus, the trachea, a lot of all your endocrine glands, so your hormone producing glands in your gut, It deals with inflammation and immunity. It really is essential to healthy functioning in the body. But our brain doesn't necessarily pay a lot of attention to it because our threats don't come from the inside of our body, they come from the outside. So if we have vagus nerve dysfunction, headache and migraine, and chronic neck and shoulder tension is a really common symptom of that. The vagus nerve and the trigeminal nerve are very tightly connected. And there's a few other nerves that are in part of this little club as well. And one of those is the spinal accessory nerve. And the spinal accessory nerve is the one that activates SCM, this one on the front of the neck. That was our first picture there in our headache slideshow. And then TRAPS, which is another really common headache producing muscle where it's got its trigger points. So those nerves, those three nerves are very connected to each other, and we can work with all three of them to get the nervous system. It's almost like a nervous system rehabilitation to get the nervous system feeling healthier again, and then get our bodies feeling healthier again. So soothing the trigeminal nerve has made a huge difference for a lot of my headache clients, especially those who also have jaw dysfunction. There is also a jaw dysfunction workshop that'll be up on the YouTube channel right away. So I'll show you how to soothe that trigeminal nerve. This is one that probably as I start going, you'll think, oh yeah, I've seen those points before. Those are ones that I regularly poke at when I have a headache. And again, most of us tend to poke at them quite aggressively because it feels good temporarily, but we don't want to do this aggressively. We want to do it in a soothing way. Imagine that the nerve is sitting underneath your skin like a piece of tooth floss or even a hair as it gets to its finer ends. And we're trying to calm it down as opposed to aggravate it. So this is like, I don't know, if you have a pet and you do this like stroking their nose on your cat or your dog, that actually is soothing their nervous system as well. It's one of the reasons they like it so much. But that really light pressure we use when we touch that like velvety fur on our pet, that's the kind of way I want you to work on yourself here. So the first point, and I do both sides of my face at once, and I do each of my pathways 3 times for the trigeminal nerve, just because 3 is very predictable and soothing. So there's this little notch under here, the supraorbital notch, this little divot in the brow bone here in the orbit. And when you get into that spot, if you press hard in here, it's probably going to feel achy. We're not after causing achiness, but if you do get an achy sensation, you know you're in the right spot. So if you get that achy sensation, cool, you're in the right spot, but let's back off of that a little bit. So we're not putting pressure in here so much as we're just touching. You can do little circles. You can take the skin and pull it in any direction that it feels good to pull it in. And after, 5 seconds of interaction here, very, very gentle pressure is okay. I sweep my fingers out the bone towards the temple, ending near my temple. And so I'll do that 3 times, little bit of time here, and then sweeping out towards the temple. The next spot is right where the cheekbone meets the nose. This one too, sometimes pretty achy. Again, achy means you're in the right spot, but we're not after causing that. So go nice and gentle. This one, I might even just kind of come back and forth from these 2 points to each other. Anything in here in the top of the nose just feels really, really good. It's very soothing. So a little bit of gentle pressure in here, or little circles, maybe 5 seconds, 10 seconds if you like, and then following out the cheekbone, again, finishing up kind of towards the temples. The next spot is just to the outside of the nostril. So I'm almost pushing up and into my cheekbone. Again, you guessed it, gentle. You can do a little bit of work here, circles, pull the skin, whatever direction feels good, and then follow out the bottom of the cheekbone towards the ear. The ear is very connected to the jaw and the vagus nerve. So if you want to do a little bit of ear massage, you can do that as well. So do that one 3 times. And then the last one is at the chin, just kind of below the corner of the mouth. The easiest way I find to get to this one is to stack my fingers together in the center of my chin and then roll outward. And I just keep this sensation here, a little bit of pressure. For me, this one does get a little bit achy. And as soon as I hit this spot on the left, I get this tiny little temporary headache right here. So I give myself a few seconds there and then follow out the top of the jawbone towards the ear. And I'll do that one 3 times as well. This is often a right before bed activity for me. So my face is clean, my hands are clean, and I'm just laying in bed waiting to go to sleep anyway. So I might as well work on my trigeminal pathway, and then also soothe myself for sleep. So this is one of the things that I use to help me sleep. Okay, so then my favorite exercise for the vagus nerve is called the vagus nerve basic exercise. And to do this, it's just a little eye movement exercise. It's essential to hold the head still. So initially, when you're just learning this, great to use your hands for this. So I'll put my hands so that I've got a little bit of gentle pressure at the base of my skull where those suboccipital muscles are. Use my middle fingers for that. So I'm actually in the skin here, just below the base of the skull. So that's where my fingers are. That's not an essential part of this. I just think it feels nice. And then I'm putting my hands gently on the side of my jaw so I can feel if I try to turn one direction or the other, I'll feel that pressure on my hands. Because the thing that we're going to do here is not at all, it's not difficult, but it is difficult because we really want to turn our head to the side to look. It's like a reflex. And when we stop ourselves from doing that, it requires us to pay attention to our vision, our balance, our proprioception, that sense of where our body is in space. And it fires up this sort of internal self-examination of why am I doing this? But it forces our brain to pay attention to our vagus nerve. So a little bit of pressure here, just because it feels good. Hands on the side of the chin or side of the jaw. And I'm going to hold my head still while I take my eyes and look as far to the right as I comfortably can. I'm not going to strain my eyes here. In fact, if it hurts or it makes you dizzy or nauseous or anything like that, first of all, you can stop. You don't have to do anything that makes you feel uncomfortable to try and make your headaches better. But you can also try, instead of looking as far as possible, bring that back about halfway. So you're just gazing off to the side there. And we hold our gaze here while we take some really deep breaths. Nice, relaxed breaths, letting our rib cage fully expand, letting our belly follow. In through the nose and out through the mouth is great. And we're going to hold that gaze over there until we get a reaction from our vagus nerve, which is a yawn, a swallow, or a sigh. When we get that reaction, we come back to center with our eyes. Maybe we need to reset our head a little bit, and then we're going to go to the left. The left is often more challenging for people than the right. So if you notice that your eyes are drifting back to center a little bit more, that's okay. Just pull them back to the left when you can. Again, not straining them, not causing yourself any pain or dizziness or nausea or anything like that. We're just hanging out, taking some nice deep breaths and waiting for our nervous system to respond to this. Initially, it might take you a while to get those responses. When I first started doing this, it took me at least a minute both sides to get a yawn, a swallow, or a sigh. Now I've been doing it for a long time and I get my responses really quickly. In fact, the only reason I'm not yawning now is because I'm actively suppressing it so I can keep talking. I can barely say the word vagus sometimes without feeling that impulse to yawn. And this is good news. Our nervous system loves consistency. The things that we do the most often, it gets good at. It smooths out those neural pathways and it feels like that's what we want to be doing. And one of the things I love about this work for managing stress is that I think stress management or stress reduction almost becomes this overwhelming task that, we think at the end of the day, I'm stressed, I need to come home and do, go for an hour walk outside in nature, or maybe I have to get to a yoga class, and of course, all of those things are wonderful. And if you have time or can make time for those, please do. But that can feel really overwhelming. Now it's another chore to do to try to manage my stress. And because our nervous system is so adaptable and so teachable, the things that we continue to do over and over again eventually start to become easier and hopefully eventually become our default. So when I intervene in my stress response regularly throughout the day, I start to feel myself get dysregulated and stressed. I can use that basic exercise or some breathing. I really, really like the physiological sigh. Again, I don't have time to teach all of this now, but check out this vagus nerve self-care video, and that will show you how to do that physiological sigh as well. So I just have all of these short tools. They take me 30 seconds maybe. And it's not going to last forever. I'm not just going to do this nice little eye exercise and then feel not stressed for the rest of the day. But as I continue to intervene in that stress response, my nervous system has started to learn that it's okay to come back to my relaxed nervous system. That's where I get healing. That's where I deal with inflammation. That's where I feel safe to connect with my loved ones and do my executive function and all those things that are really important. And this work absolutely makes a huge difference for me in managing my stress levels. Okay, so I think that's all we've got time for on the nervous system. I'd love to give you more information there. And if this is something that's really interesting to you, please reach out, because it is a tool that not only helps to manage headaches, but a lot of the symptoms of vagus dysfunction as well. Okay. So let's talk about stability, mobility, and consistency. As you can see, I've rated consistency as very, very high. I think it's the most important thing we do. Our self-care should be daily. But again, we got to get this so that it's doable. So I have a couple of stability exercises to show you for the neck and shoulders, a couple of mobility exercises to show you. And what I like to encourage my clients to do is to try these things. Let's try one for a week and see what results we get. If you're feeling significantly better, great. Maybe we landed on the right thing first. If you're feeling a little bit better, okay, maybe we need to lean into it a little bit or add something to it. If you're not feeling better, then we need to try something else until we find something that actually does work, because everybody's different. So a lot of this is a little experimentation. I have a bias towards stability is essential for the body to be able to move properly. Our nervous system doesn't like joints that feel sloppy or loose. So I have really, really tight neck and shoulders, but I am incredibly flexible through my neck. Because my joints are a little bit sloppy, I'm a little bit hypermobile. And so because we should be using ligaments to help our joints to feel stable and solid, if those ligaments are a little bit loose or sloppy, the nervous system will activate and will tighten up muscles and tendons in order to try and keep that joint feeling stable. So I've got, like, quote unquote, great mobility. When I'm in a massage, my massage therapist can take my head, move it, I'm relaxed, they're moving my head for me. They can put my ear on my shoulder without me feeling a significant stretch through the side of my neck. Though those muscles are like guitar strings, they're so tight. So I'm not getting benefit from stretching, because for me, my nervous system doesn't want to let that tension go, because why are you moving your head so far? So I have to increase my stability in order to reduce my muscle tension. And this works for me across my body. Lots of my joints are hypermobile. And when I reposition them properly, train my body that it's okay, I can keep them stable, then I get a good reduction in muscle tension after that. So I'm going to show you a couple of stability exercises here, and then we'll go into the mobility exercises, and we'll talk just a little bit about the consistency that I think we need to make some good change. Okay. This little exercise is called Ironman. It's one of my favorites for shoulder stability. So this video is not perfect at showing you exactly what I'm doing, so I'm going to just describe it as well. I'm going to take my shoulder blades and I'm going to try and move them down my back as far as I can. And then I'm going to bring them in close to my spine just a little bit. So I'm activating this depression of my shoulder blade, trying to get it towards my hip. And I'm bringing my shoulder blade in towards my body. And then I'm going to tuck my chin and pick my head up just a little bit. So you can see I go down first, and then I'm bringing my shoulder blade in, tucking my chin and bringing my head up just a little bit. So, and I'm hovering off the ground for about 10 seconds, and I come back down again. So shoulder blade goes down and then sucks in towards the spine. I know that looks like I just picked my arm up, but I'm actually moving my shoulder blade in towards my spine, tucking my chin and lifting my head up off the ground just a little bit. You'll notice I'm not arching my neck. When I pick my head up, I'm keeping my chin down and essentially moving my spine, my head backwards, so that it's coming up a little bit. My spine stays nice and straight in this movement. So this one I do every other day. I hold it for 10 seconds. I do it 3 times. It is something you can learn how to do this. Also leaning forward, like standing and bending forward is a little bit harder to do. So I tend not to teach that one until I've seen somebody do it effectively. Let me just get this out of the way here. Okay, this one is a scapula push-up. So what's going on here? I'm on my hands and knees, comfortably positioned. And I'm going to try to push my shoulder blades away. So as I push my hands down to the ground, I do arch my back a little bit, and I'm sliding my shoulder blade across my rib cage. So it's coming forward. So it's this movement here. So if this is my straight arm, I'm taking my arm and pushing it away. So my shoulder blade slides across my rib cage and down towards the floor in the image, or outwards here. And then I'm also going to take my shoulder blade and suck it in towards my spine. So you'll see I do round my back a little bit in here, but I'm not getting a huge arch to my back either in my lumbar spine or my thorax. I'm really trying to focus on this shoulder blade. So the shoulder blade comes down away from my body. Shoulders, so shoulder blades in towards my spine, down away from my body as much as possible. So these two are favorites of mine for stability. This is how I get my shoulder blade to be as stable as possible there. Okay, we're just going to leave this here for now so I don't have to start the whole presentation again. Okay, so those are my favorites for stability. The other one that I do pretty frequently, and this is easy to do, it's easy to do, you know, if you live in Cochrane and you wait for the train a lot, obviously make sure you're safe doing this. But you can sit in your car and do a little bit of work on the strength of your neck. So I keep my head totally neutral, one hand on the side of my head, and I'm going to push my head into my hand and meet that force by pushing my hand back into my head. So I'm not actually moving in this muscular contraction. I'm just activating muscles along the side of my neck to push my head. Like I'm trying to do this, but I'm stopping myself from doing it with my hand. I start this very light, like I'm using maybe 20% of my force max to push my head into my hand and hold that again. I like to hold these for about 10 seconds, rest and repeat. I'm going to do both sides. I'm going to go forward and back. So I'm just pushing my forehead into my hand, pushing the back of my head into my hand. And again, just gentle contractions to start. Once that starts to feel good, once that starts to feel strong, you can absolutely start increasing the force that you're using. You can also take your head into different positions. So you can start with your head partly over to the side, activate at that point, hold that for 10 seconds. You can come a little bit farther, hold that for 10 seconds. You can do that in any of the directions that you want to strengthen here. I like going all the directions. You can also do this with rotation. So if you're turning your head to the side and hand on the side of the head, and then I'm trying to look back towards the screen here, and again, stopping myself from doing it with my hand. Gentle pressure, starting with, 10 to 20% of my force here and holding that for about 10 seconds. If it hurts when you're doing it, stop doing it. Okay, for all of these things, if it feels bad, stop doing it and get a professional to show you how to do it. But if you are feeling like, oh, it's like maybe a little bit uncomfortable, try knocking it back by about 50%, because the vast majority of people, I tell them to use about 20% of their force and they go right away to like 50%. So just start really, really nicely on yourself. Take it easy. Okay, going on to mobility. So my favorite neck stretch is the neck lateral flexion and rotation. So I'm going to do a full 180 degree with my head, but I'm going to do it with my ear towards my shoulder. So if I'm stretching this shoulder, I want to keep this shoulder down. So I might sit on my hand or stretch my arm away. So I might be in this position with my hand stretched away from my body and trying to sort of tension between the hand and the head going sideways. So nice relaxed position. Both shoulders are down. I'm stretching my left shoulder. So this shoulder is staying nice and low, and I'm bringing my right ear towards my right shoulder. You can hang out here. This is probably going to feel pretty good right to start with. But then what really makes this stretch effective is we're going to do the rotation. So I'm going to bring my chin down towards my shoulder, and I'm going to wait here for 20 seconds, 30 seconds. Really wait as long as you need to for it to feel better, for it to feel different. So I'm down here. And then the next thing I'm going to do in this movement can be confusing is I'm going to look the opposite direction. So I'm rotating my chin towards the ceiling on the opposite direction. So I'm now over the shoulder that I'm stretching. If that feels confusing or you feel like you're not getting it, you can start with that position. So head to the side, look up. And then if you can just go right into looking down, that's great. But you can always just reset. Bring your head to the center, ear to the side, look up, head to center, ear to the side, look down. And again, with stretching, with movement like this, our goal is to reduce tension in the muscles, not necessarily to make those muscles longer. So you can do whatever feels most effective. Some people really like a long, slow hold. They like to breathe into this. They're going to wait here for 30 seconds or a minute, and then here for the same length of time, and here for the same length of time. Other people, it might feel great to move with your breath and inhale here and an exhale here, going back and forth until that shoulder starts to feel different. So experiment it with a little bit. I've got more variations of it as well that I can show you if that's something you're interested in. I would spend at least a minute on each side to make sure that, again, we're getting change that feels consistent. Okay, and then last one for stretching is I like to do chin tuck. So this is the same kind of position I was showing for getting a stretch to the suboccipitals earlier. I'll show that again. I typically would do this with my shoulders back against a wall. So I'd be leaning back against a wall, shoulders nice and down, back supported against the wall. And then I'm gonna, again, bring my head back as far as I can. So for me, I can bring my head back to touch the wall. You don't have to do that though. Go as far back as it feels good to you. And then we're going to tuck the chin towards the throat and hang out in that position while we get a stretch to the back of these suboccipitals. That's when you can do also if you're sitting in your car. Again, obviously you need to make sure that you're doing this safely, but you can push your head back into your headrest, tuck your chin down, and then you can actually push back more to get a little bit of strength activation as well through the neck. So lots of ways that we can play around with these to make them work really well for you. And again, consistency. This is the thing I think is super vital. But I noticed I did a case study on headaches when I was in school, and my client got 14 weekly treatments, and she went from 3 or 4 headaches per week and probably 2 migraines a month to some weeks getting 0 headaches, and other weeks getting, just 1 headache and it wasn't as bad, or, as it started to get bad, she could intervene with some of these skills to get that pain response down. But what we noticed is the weeks she did her homework, she had way fewer headaches. The weeks she didn't have time to do her homework, she would get more headaches. So again, massage is super helpful. We changed how the tissue felt as we went throughout this treatment, and her results from that 14 weeks were lasting for quite a while, but it was absolutely the consistency that she could give the homework that made a difference. So I highly encourage you to get after this daily if you can, even though, of course, I know that that is a challenge because daily self-care is always hard, way harder than it should be. Okay, here's some contact info, website, email, Facebook, Instagram, and you have the YouTube channel because that's how you found this. So absolutely, please feel free to get in touch with me. I love talking about muscles and how to change how they feel. I really love working with people to get them out of pain. So if you need massage, I'm more than happy to work with you. But again, I hope that during this presentation, you learn some skills that are going to be helpful for you. Right away, you can start managing your own headaches with this. And yeah, I wish you less headache pain. Thanks for attending. Thanks for being here. And yeah, take good care of yourselves. Bye.